Hi, welcome to Introduction to Clinical Energetics with Gary Strauss at Pacific Center for Lifelong Learning and Pacific College of Health and Science. I'm Cynthia Nypris, VP of Continuing Education at Pacific College. I want to thank Rob Nadeau, our Operations Manager for PCLL, Pacific Center for Lifelong Learning, and Jose Castillo, our tech host tonight. Gary Strauss is a longtime friend of Pacific College, over 2 decades now, teaching clinical energetics and related subjects in New York, California, Japan, all over the world. I will let him introduce himself, but want to say that we consistently hear back that his classes are some of the favorites ever taken in terms of making our practitioners work with their clients more effective. Gary will be teaching an on-ground workshop at our New York campus, October 14th, and I'll put a link in the chat to that later on. If you have questions during this webinar, you can put them into the chat and we'll share them with Gary. He may or may not have time to answer them all. We may have time for a sample treatment. So if you have some significant pain tonight and you want to volunteer to go public, put your email and what your pain is in the chat if you're willing to do that. And we will have one of you maybe get a sample treatment. So without further ado, please welcome Gary Strauss.
Thank you so much, Cynthia. That was lovely. And it has been lovely to be a part of Pacific College for so many years. One of my favorite places by far. And maybe you guys want to put me in the spotlight if you haven't done that already. So I have been in energy medicine since around 1980. And I've been a practitioner and a teacher. And I've been training practitioners and teachers all these years. I have trained on all different continents. You heard that from Cynthia. I train currently in Japan and in Europe, in New York, California, Arizona. I've actually been slowing down the last few years, believe it or not. As I'm getting older, I find it's not about the quantity, it's about the quality. And years ago, I had a student in one of my classes who was from Pacific College, and I was teaching them energy-based ways of orienting and being and relating that improve the work that you're doing or actually facilitate it. And that student thought that acupuncture students should learn it too. It began actually a journey where I've trained many acupuncture students, massage therapists, body workers, psychologists, physical therapists in clinical energetics. And that's what I'm going to do with you today. Let me just put this in the chat. Might be good, if you can, to get me as a spotlight. If you don't know how to do that, just make me the host. I'll do it myself, but I'll do that. Let me put up I'm going to put up a board. So today, I'm going to share what clinical energetics is, the work I created, which I love and I love to teach. And I'll try and explain it to you as I know it. And then I'll show you a little bit about it. It's mostly about nature. If you want the short version of it, let me pull up my PowerPoint. It's about nature. And I think you know, and everybody does, that nature heals. It heals by itself. And we can find a way to use it. If you practice Tai Chi or Qigong, I'm sure you know what I'm talking about, or you practice Kundalini Yoga, or you like to be in nature to restore yourself. In Switzerland, I've taught there many years, their primary healing method when someone is ill is to send them to a sanatorium. A sanatorium is a beautiful hotel in the mountains that has no internet, no telephone. You get there usually by a train. There are no cars usually where they are. You get to eat clean food, walk in nature on your own, and generally you don't have visitors. So they found in Switzerland that when you are off in nature by yourself without outside influences from the world, that you tend to reset and reorient. And many times that's enough to heal whatever distortions or disturbances there are in your body or your life. And the world that we live in is ever more full of distorting influences and things that take us out of ourselves, things that disturb us and or even aggravate us and cause aggravations in our bodies, in our mind, in our emotion, in our life. This work, this energy work, energy medicine in general, I think, is a great answer to the times that we live in. It helps people with trauma or pain or disturbance or just not being right, helps people to come back to themselves. It restores nature, if you like. That's what I believe about it. And in fact, right now I've been in Maui for the last week working with first responders and people who've been traumatized by the fires that are here. We have a program we created to bring our practitioners to work with people who've gone through trauma, lost their home, lost their loved ones, et cetera, and just a little bit of energy touch and a little bit of work and a little bit of what I'm going to teach you here helps to restore, I think it restores humanity, but more specifically, I think it restores your own energetic integrity. And maybe our culture, our civilized world in some way is taking little bits of our humanity away or distorting our energy integrity. And this work restores energy integrity. Acupuncture restores energy integrity. Good body work will do that. Good Tai Chi, good Qigong, good meditation, good Kundalini yoga, good Reiki, Shiatsu, anything you want to talk about that works with energy, I think. And the thing about energy that's, not that massage or deep tissue or body work doesn't do it, but the beauty of having an energy-oriented massage or an energy-oriented acupuncture is that energy can go deep within the body without pressure. It is deep within the body. And contacting it, you can access things that are underneath things. That's the beauty of energy work and the energy world we live in. Everything's made of energy. So if we work with it, we're working with everything. So this is a kind of everything approach to, it's not just, we say clinical energetics because it's an acupuncture school, but these skills should be taught in public school. Everybody should learn this. We should know how to honor ourselves, how to honor another human being, how to be supportive, how to help them to heal in times of trauma or in times of how to just be a good human being even. So this is I'm going to go through my PowerPoint, but I will tell you this. So I calculated this at one point that in the last, it's been 40 years that I've been in the healing arts, 40 plus. It's been we're going on 44. Getting up there. It's energy, by the way, that has kept me healthy. There's no question about it that without energy, I don't know that I'd be as healthy I am. Yesterday, I did about 5 or 6 sessions. The day before, I was working with animals all day long. I come out of that and I feel good and I'm ready to do it again. And I've been doing that consistently every week for 40 plus years. And in that time, I've done more than 50,000 clinical sessions, not to mention the thousands of classes and students I've worked on in class. And so it's been a library of this clinical experience that I've had that has taught me what I'm going to teach you. I didn't learn it in a book and no one ever taught it to me. It's the things that I found inside the work that were working that I wasn't taught that I found were incredibly effective and were not based on the classic techniques that you think about releasing things in the body or acupuncture points. Those are all great things. But this clinical energetics takes whatever it is that you're using and it optimizes the potential of whatever that is. Whatever your intention is in the moment, this will improve it. Whether it's just you're with a friend and you're being social, or whether it's with your family, or I do this at business meetings often, you know, I do aspects of this and it makes everything work better. So that I'm going to teach you that. So whether you're a clinician or not, the skills I'm going to show you are based on universal principles. When I say universal, you'll find these principles in modern physics and quantum physics. You'll find it in indigenous teachings from indigenous people all over the world, literally. It'll be consistent. And I'm going to show you 3 or 4 basic things, but the 3 or 4 basic things I show you, if you just play with them a little bit, you can get a hold of it. It's not that hard to use what I'm going to show you, and it will have an effect in the world. It'll change you and it'll change your relationship, and it will help the world around you, whether it's an animal, a person, a child, a situation, literally in life. And this is usually what I come on with. I usually say, if you could improve the efficacy of whatever the interaction is, whether it's a clinical interaction or a social one or a business one, by anywhere from 10 to 70%, would that be, I usually just ask that question, would that be interesting? And if you're thinking and listening and you care about interactions and or clinical or not, you'd say, of course, I want the outcome to be better, don't you? Even when there are difficult, I've used this in incredibly difficult decisions that were fraught with danger, et cetera, and it's worked remarkably well. Well, there is in the literature, if you, I went to school and I have a master's degree and worked toward a PhD and have licenses, et cetera, and all that. And I love science. I still, in my heart. And in the science, in the medical literature, if you read the word, if you look up bedside manner, that's the one. And bedside manner is the way that a physician or a practitioner is sitting or being with their client. And the literature now shows that practitioners with good bedside manner, the outcomes of their healing encounters are anywhere from 10 to 70% better than practitioners who don't have these kind of skills. So that's in the literature. And at the time when I studied a lot of this, less than 10% of medical schools had a class on bedside manner. It wasn't technological enough. It was it's very human or humane. So this is kind of bringing back some of what we have lost in our world and our technological frenzy that we've been in. We've lost a little I think you know that we've lost humanity, and humanity heals. I found just being here in Hawaii, aside from the things I know how to do, the best thing I could do was just to be with people and be a person and not think I'm here to help. Masaru Emoto makes these beautiful pictures, crystals of water, and he has one based on the concept, I want to help you, and it doesn't look very good. The one that looks the best is called love and appreciation. So if you just practice love and appreciation with each other, this would start to work. There's an axiom. There are a couple of them, but energy loves space. That means if there's an open space, energy is going to breathe and circulate. It's a very powerful thing. It's very hard to totally explain it. I'll write it down if I can. Where's my, I just think I have this, but maybe I won't write it down. Energy loves space. I didn't want to go there yet. And energy loves awareness, and energy loves like humanity. You think of a tree. That's what we want to be, like a tree. So bedside manner is a quality of the way you're being with another human being. And that can heal 10 to 70% or even more. And there's so much research on this all over the field of medicine, that doctors and clinics that had really good energy, that people got better in those places more than in other places. And that's some of the science on it. I call bedside manner holding space. And holding space is a term, it's a modern term we've used to talk about how you are being with something. That's really the bottom of it. How are you being with it? And I am going to show you how to hold space, how to have good bedside manner. That's what the class is about, primarily. Let's just see. Don't hesitate to chat to me if you need anything, Cynthia or Robert. Okay, so yeah, I'm going to teach you how to have good energy for yourself and how to have it in relationship. And I'm going to teach you a little bit about energy parameters of clinical interactiveness. However, clinical interactiveness, again, is also can be applied to social and or familial interaction. And my story is, I wrote Unfolding Dimensions, right? Let's see if this works. Whoops, wow, I went somewhere. I'm a little off in my ability to write on here, but we'll forget about that for now. It's not that important. I say it unfolds dimensions and opens doors. That's the short version of it. And I'm going to make another statement that most of the time we're not that open. We're actually much more closed down. That's just what I found by receiving people, that people are actually quite guarded, protected. They're not as open. You're not as open as you think you are energetically. Because look, all the people that come in, I have never had a client walk in and they're open energetically. And usually you can imagine one of the reasons is that when you get hurt, what you do is you try and protect yourself. You close in on it. That's what your body does. It creates an inflammatory response to protect what's been injured. And we're being kind of injured and bombarded all the time, consciously, emotionally, energetically, so many different ways. So, I just gotta take it easy. But either way, when people come in, they're not so open. And this is about learning to open up. Now, if you spend time each day and you just breathe in the morning and you think about opening yourself up, you will, because energy follows thought, or energy follows awareness. And whatever you spend the most time on, that's where your energy goes. So spend time on good things, thinking good things. It's true, energy goes there. Spend time the other direction, the bad neighborhoods, energy goes there. Energy doesn't care. It'll go wherever you tell it to. It's like that. It has its own intelligence, but it'll be related to wherever you go. It's made that way. Somehow in our evolution, our energy will go wherever we go with it. That's the way it works. So it's like I said, restoring nature, or another way to say that is unfolding dimensions. So if you're closed and then you start to open, so when you're closed, there's compression, and you're living in a compressed world, and we all are to some degree. And in that compressed world, oftentimes you're a little cranky, or you have pain or distortion. And in an open world in general, you don't have a lot of pain or distortion. You start to flow, and nature restores itself. And when I say nature, I really mean heaven and earth. I mean everything, breathing, pulsing. Life is pulsatory and energetic. If you woke up in the day and you thought, I'm a living, breathing, energetic being, I'm connected to the earth and heaven and the space around me, which is a traditional indigenous prayer to wake up to, you would be opening up pathways of energy that flow in and out of your body. That is my premise to you, to contemplate that you're actually energetically related to everything below, above, and around you, whether you think you are or not. That this is more like anatomy. It's not affirmation, it's anatomy. So let me show you a little bit of it. And then perhaps we'll see if you have questions. This is a picture from Alex Gray. And this is the human energetic. This is if you see the line down the middle, that's the center of your spine. And where the energies cross horizontally, those are chakras. And then all these lines are meridians of the body and the auric field. And it shows that the energy is the body's made up of energetic threads and lines and meridians, etc. And the first teacher I had said that your energy matrix gives the direction for your cells to become what they're supposed to become in your body and your being. he thought, and a lot of people in craniosacral and in energy medicine believe that energy comes first before your body. And so working with energy is kind of like restoring and resetting. Anyway, that's Alex Gray. Let me keep going. This is a picture by the Planck telescope, one of my favorite ones. Planck was a physicist, and he was very important to the generation of the theory of relativity that Einstein figured out. And they made a telescope after him, and they took pictures of the night sky for a few years. They decommissioned the telescope and landed it, I think, on an asteroid. But what it did was it would be in the Earth's outer orbit, taking pictures of the sky away from the Earth. And it was taking frequency-based pictures. So this picture is a composite of a one-year survey that the telescope took. And our astrophysicists believe this is the first light that showed up in our universe that we are still seeing today, if you can fathom that. And that light originated 13.5 billion years ago. Who knows? Yeah, so the indigenous thought is that, and we could stop a moment and do this, everybody could do it. I'll give you a little direction. You could think, I am living and breathing within my own energy body, within my own sphere, within my own field. And I'm breathing in relationship to the earth and exchanging energy with the mother, if you want to call the earth your mother, and with the sky or my father, if you want to call it that, and with the world around me, all of my relations in life. And I'm exchanging energy in alignment with my highest good and with what is right and healthy for everything. Win-win. And you could think about your brain and your spine, because that's the center. We care about that a lot. Or you could just think about your whole body and your field. I hope that helps you. I think it's a really good way to start the day. This is a picture from the universe. And first light, 13.5 billion years ago, if you can go with that. If not, I'll let you do the science on it, but I believe it. There's a line through the middle of white. It's kind of like a midline of life. The midline of the universe, there's a midline in all things. Your spine is a midline in craniosacral, and your cell has a midline that it divides around when it splits. And then the earth has a midline also around which it has an electromagnetic field. So this is the electromagnetic field of the earth. My teacher said that it is the electromagnetic field of the earth that gives rise to life here. It's what makes a difference. It's not just the water and everything else, but the field itself. Without it, we wouldn't have the gravity that we have, and we wouldn't be able to be within this realm walking on a planet. The moon has very little gravity, I don't know what kind of life lives there, but very little, not like what's going on here or any of our planets. Mars has more gravity, I believe, and they think life can happen there, but who knows? But right now, and maybe life came from there, and this is the life we're living from Mars. But on our Earth, there's a beautiful field, and that field gives rise to life. And this is a picture of that. And then this is a picture of it in dark, so you can see it clearly. And you can see the core of the Earth on this. And the core of the Earth is generating this huge electromagnetic field that we live in. The sun has one as well. And when there are sun flares, it disturbs our field and disturbs our energetics on the planet. And probably we are affected by all the celestial things all the time, energetically. So there's a great field of energy around us, whether we know it or believe it or not, it's there. And there's an energy of the earth that's beneath us, and there's an energy of heaven. No question about that. And if we think about that, that's nature to me, and we breathe with it, we can restore ourselves. And a lot of the work that I teach is teaching people how to orient within that framework and how to do that as a practitioner. So you could say that's what clinical energetics is about. And this is a picture, this is like from Da Vinci, his Vitruvian human being, and he's showing the field of the human being. Now, these pictures are a little too, the lines are too straight. I can't imagine that it's this perfect, but it gives an illustration of we have a field as well. And my statement to you is going to be that your field is really important for your healing, profoundly important. Also, not only is your field important, your field and your energy has a kind of intelligence in it that's like intelligence within the universe. And like sometimes we think as human beings, oh, we have to be conscious of things for them to work. Everything's working without our consciousness within it. Our consciousness is a part of everything working, but things don't need our consciousness to work necessarily, not the way we think about it. But we can use our consciousness to become part of the intelligence of nature and life, and we can restore balance in our body, in our field, in our relations. That's probably the best thing I could say about this. And so I'm going to let this go. We're going to take it down. At least I think there's another one. That's just the 6 directions of indigenous peoples, but we're still going to let this go because we don't need this anymore. And I'm going to come back to you. And if you do have a question, don't hesitate to type it in. I'll get to it eventually. But I want to show you 3 different things that I'm going to show you in a moment. I'll put up another screen. I should be able to print on this one. So I told you these are aspects of clinical energetics, aspects of, I got to change that. That's not going to be happy. Sorry about that. Got to make it extra thick and got to break it bigger. Let me try that again. Why didn't that get thicker? Oh, let's do it like this. There we go. Okay, so clinical energetic aspects. Okay. And I'm going to do 3. Okay. And the first one is energy loves space. And then the second one is energy loves awareness or neutrality. That's, we're going to have to parse this a little bit, but you'll just take it from me the way I'm giving it to you. And then the last one is, this is my favorite one. What's the color for it? Okay, let's do this one. Energy has its own intelligence. For me, this one makes me a human being even more, because then I realize I don't have to know everything. So energy loves space. So if you're ever, you probably do this already if you're down or disturbed. And one of the things we don't do enough is just to go off by ourselves somewhere, to be alone. And especially if we go into nature, our energy will restore itself because it will get space. It's very hard to restore yourself in the middle of a crowd. It takes a lot of focus. You can do it, but way easier to go into a big space by the ocean, mountain, etc., anywhere nature, because nature's energy is resilient there and unfettered. And moving into an unfettered space, wow. So I'm going to try and create that space here. And I'm going to teach you how to create an unfettered neutral space. That's part of what you learn. And then you also learn how to be in your awareness with each other. And being in your awareness is like being contemplative. It's contemplative practice. It means, it isn't that you don't have a point of view, but you're less interested in your point of view. You're more interested in whatever it is that's in your relationship and in your field and whatever someone shares with you. You're not interested in figuring it out. We're not doing that. Neutrality is letting things be what they are. And in our world, things don't get to be what they are. We're fighting over things everybody's offended by everybody else wanting things to be the way they are. Literally. And everybody has a different idea about what that should be. But this is about really letting things be what they are. That's a hard one. It can be very challenging. But it's neutrality heals. Awareness heals. And energy has its own intelligence. So this is my favorite one. I'll back it up one more time. Your body has been healing itself your whole life. and it has healed you through miraculous situations. And because you might have a symptom or so, doesn't mean you aren't being healed all the time by your own energy and your own body and your own intelligence. It's working fine, and it works by itself. And if we have a regard for that, it's going to empower it, because energy loves awareness. It follows where you go. And if you think my body is miraculous, you'll improve its miraculousness. The contrary to that, I don't want to say, because I don't want to get you to think that. You think it enough. You think worse things about yourself than anybody else. We all do. It's organic. So for me, energy has its own intelligence. I can rely on the intelligence of energy. And I'll show you how to do that. Okay, so that's my short rendition. If there are any questions, I'm going to stop the share. Here we go. Does anybody have anything they need? Any other questions up there? If not, I'm going to go to the next place. I'm going to show you what I'm talking about.
Gary, we do have one question. A couple of people asked if you could repeat the morning Indigenous prayer.
Again?
Mm-hmm.
I thought I just did that. But I'm paraphrasing it. I'm paraphrasing the morning Indigenous prayer. But I would say it like this. If you wake up in the morning and you affirm your own energy, your spine, let's say, and you breathe that, and you think about the earth, and you breathe with the earth and let your energy exchange with it, just sitting outside, inside, wherever you are, and you think about heaven, and you're breathing with it, and you think about all the space around you and all your relations in life, and you think, I want to be here in the best possible way between heaven and earth, honoring all of my relationships in life, and I want to breathe with that energetically in a right relationship way. That's the essence of the Indigenous prayer. Sometimes that prayer sounds like Aho Mitakuye in Lakota Sioux. Very similar to what I just said to you. Or that could be the mantra Soham in Sanskrit. Very similar. It's about universal and individual breath and realization. And it could be about having a right relationship between you and the world around you. So if you wake up in the morning and you get a little quiet, if you breathe out slowly, long breaths, and you breathe in and breathe out, long breaths, and you think, I'm here within myself, within my field, with the earth, with heaven, with all of my connections in life, past, present, and future. And I'm here in the best possible way to be the best possible human being. That's a great prayer that aligns your body and your field and your life. Very simple. And if you did that for 2 minutes a day, your life would change. And to see that, you have to do it and then tell me that it changed. It will. I've done it. I've done it my life without it. I've done my life with it. It's a process of organizing your energy. And this is all about organizing your energy and then your relationships. That's what clinical energetics is. How is that? I'll wait for a response.
Great.
Is that good? Okay, so I'm going to do a demo of what I'm talking about, and then you can see in action some of this. And obviously this is what we're teaching in the class. So I think Robert will be my demo. Can I just get us in the spotlight? Do you guys know that? Spotlight. Oh, here we go. I can do it.
If you click in the upper right view.
Yeah, I got it. I'm going to add you. Oh, wait, you got to turn your thing on, Robert.
Yep. Give me one moment.
I'm going to give it to you. Yay. Okay, let me try that.
All right, here we go.
Now I know what I'm doing. Robert. So nice to be with you. So how are you doing, by the way? How are you just doing generally? How are you?
Generally, I'm doing pretty good. A little bit of work stress and stuff, but for the most part, Really, really well. I've done a good job lately at taking a little bit of time out for myself. For me, I find playing pickleball, as silly as it
Yay.
sounds, it's really therapeutic for me, not only physically but also mentally, emotionally. It really helps with a lot of things I found out. But in that, I have between sitting at a desk all day at a computer and then running out to go play pickleball, my low back has definitely experienced a bit of pain lately.
Okay. So first rule for everybody is to be a person and not be an operator or a practitioner. Sometimes that skews things. So I was just wanting, really, I'm interested in being with Robert. I don't know him. We just met. And I like to hear what he said. And when he said everything that he said, I'm not taking notes and I'm not writing it down. I'm listening to what he said. And I thought it was really cool, all the things that he said. And I should be interested. If I'm not interested in listening to people, then I shouldn't be doing this probably. But I am. And I loved what you said, Robert, about all of it. I heard about the pickleball and yeah, that's a thing these days, right? It's a cool thing to find in life. And anyway, I heard that. And I heard that you were taking space and all that. So mostly I just want to be with what he said. So clinically, we teach people to be able to listen to people's words and what they say, not what you think they said. Not like, I'm not going to make a judgment, oh, Robert needs more time. I'm not doing that. Do you understand? That is like the wrong thing in the moment. Later on, you can be as critical as you like, but in the moment of getting to know somebody, you should pretend you don't know anything. You don't know anything about their life, and you're not really very entitled to it either. But you are going to spend some time, and you should have good manners about listening and being attentive. And in the somatics world, they say be curious more than anything. That helps, because being curious allows energy to flow. Coming to a point stops it. Now you said this is what it is. And rarely is anything this is what it is, because we live in a quantum universe where everything has dimensions. So I'm just appreciating everything you said. And you did say, and this is why we're here now, that you had some low back. Is that true?
Yes.
And in the moment, what are you feeling? We're interested in present time and awareness. And so I'm asking, and you could watch him. He went into his, gone into his process.
More of a tension, like a tight feeling.
Cool.
I feel like I can't get it to open. It just feels all
Great.
clustered and stuck together,
I have a clustered tension, which personally I love, tensions and pains and things like that. Not just because I make my living about it. I do, it's true. But more like because I appreciate that there's, when your body has tension, it's a sign of intelligence. Remember that I said that. And that intelligence is talking about something. We might understand it or not, but either way, it's talking. He has attention. You saw him do that. So I'm appreciating that, letting that be here. That's all. I honor if you want to say that, I don't always say that to my client. I'm not trying to use this as an educational thing. Oh, your pain has intelligence. I'm just trying to tell you that you should honor the intelligence of everything, even the pain. And I know that's counterintuitive. We want to destroy that pain oftentimes or get rid of it. But that's probably not the best way. Okay. So you said strain. And do you notice anything happening in your body also? Is anything else going on, or is it just the strain or other things?
Just in my low back, just that tightness.
Tightness.
I do have a little bit of a respiratory cold going on as well, but it's pretty mild at this point.
Okay, cool. So just nice to know that. So would you, if you measured your discomfort, how much would it be?
Right now?
Yeah.
Probably about a 5.
5. That's what I wanted. I wanted to be able to measure this so we could see what I'm going to do. So again, don't go to any conclusion. Just let whatever is being there. Let me say like this. I don't tell my clients this. I'm telling you. He's already processing in his energy. The idea that he's going to start processing because I do something is kind of stupid. It goes against the intelligence of his body working. His body's working at it. And maybe it's been getting better, right? But he's still at a level 5. and I'm going to add something that's going to help his body process it more. That's what I'm going to do. But the thing that I'm going to add is more like emptiness. And you'll see how I do that. Okay. So the first thing I'm going to do is give you some space. Okay. Now, I am physically going to back up in a moment. And I know this could be counterintuitive, but in the quantum world, if I back up here, wherever he is, trust me, he's going to get it because we are related over space and time. So I'm going to back up and I want you to notice how it feels as I do. So the first thing you do in this, and oftentimes when something has had trauma, the thing that it lost was its space. And when you give space back, I know it's going to be so funny, but it really, because somebody's giving it space and room, it starts to breathe differently. And you could see him, he's shaking his head. I'm going to move a little further off. I'm just moving off a little to the left. And I'm here, I'm not going away. I'm just giving space. So that Robert could have some room. That's all. So that energy shape I showed you, so it could be able to have a little room. And that's the intention. And I tell people, I'm going to give you a little room, but I'm here with you. And I want you to kind of, gentle. You don't have to, there's no work in this. I just did it. I gave space and I thought, let me give you room so your energy could have some space that it needs. That's all. That's all it is. And if you do this with things in your life, oftentimes you give them space, they'll surprise you and they might open up and change and move. A lot of times things are the way they are because we're on top of them. We're involved in them. And we have to get a little involved sometimes for them to have room to process the way they need to. How is it now for you? Just anything about how you feel or what you noticed happened?
I did notice almost right away, maybe it's seeing you back up, but you feel that space. Like I feel like I'd breathe a little bit deeper, just, yeah.
And however that is, and without looking too much, has the sensation shifted at all?
As far as physically?
Yeah.
This might sound weird. I feel like I have some tension more up in my upper shoulder and upper back instead of just in my lower back. It's
perfect.
It's a little bit of tension has moved.
Yeah. So tension doesn't move, but energy does. And energy is showing you another tension place related to the tension place in your back. See, you think, oh, this is about my back, but it's about your whole system. And if I give you space and your energy starts to move, it's going to show you other tensions in your body. Always does. And that means it's circulating. It's started to move. So giving space, and I'm going to give it a little bit more. I don't have much more in the room, but I'm going to give him a little more and let him have his room. And maybe I'm going to move off to the side because I can't go back any further. Because I want him to have his, yeah, okay, good. Just see how that is. So he decided to move back. That's perfect. And now we have more room for his energy field. And I'm saying to do what it needs to do. So that's, there's awareness in here, there's space in here. I'm giving him space. And he told you he could feel tension, change in his shoulder, and he could feel, maybe he felt like he could breathe. Good. So that's the first thing I'm showing you. It's called giving space. Even though I call it holding space, part of it is giving it. Letting people have the room they need. And you probably know yourself that at times you don't really have the room that you need. You're aware of that. But so much of what's going on, we're not aware of. Yeah, good. So I'm just letting him have that. I'm going to add another thing. This is the third thing that I told you. So I said awareness, we're in awareness. And I gave space. And now the third thing is, this is the one that I love. And I breathe. When I think about it, my body opens even. And I think I really trust his intelligence to take care of him. That his intelligence knows. I don't necessarily say this to my client as part of this. I usually just think, I really, honor, trust your own intelligence to take care of you the way that it needs to. However that is. And, if you did this by yourself with whatever your issues are, it would help. But if somebody does this for you, it becomes magnified. And you can see him moving and switching. And the movement and the lip things and all that, that's energy. That shows you body movements, energy moving. It's circulating. So space, relation, or awareness, or being a human being, and then honoring of intelligence. These are indigenous principles. These are principles in craniosacral therapy. They're in shiatsu if you learn it in Japan, in a good place. They're in acupuncture in Japan. They are in China, in the right environment. We honor the intelligence within someone's body, their meridians, their field energy, their life. And we think, I'm here to support that intelligence. So for me, when I think I really honor your intelligence, then I think your system knows how to take care of you. And I feel that when I say it every time, or when I think that, I feel something. The wind blows, it feels magnetic. When I think like that, I become more part of nature. I become a right person for another human being. Anyway, that's some of that. How is it now for you? What would you say about how you feel or what you're aware of?
It's it's interesting. The low back pain, I mean, it's there, but it's definitely changed. And if anything, I feel like it's lessened, but more dispersed, right? If I had to describe it, the actual feeling in my back right now, it's where it felt like it was all right there in the low back, now feels like it's just gentler and spread thinner.
Right. Yeah. And that's your system starting to circulate the way that it needs to. That's my story about it. And usually we don't get to have the space around things that we have. And when someone gives it to us, or we go to nature, our body opens up because it has room. And then we get to circulate naturally on our own. So that's this first little piece. Great. Good. Thank you so much. That's just what I wanted to do with you. Yeah. And that will continue probably to process by itself. And at no time I'm going to come back. It might be a little pressure. And then I'll let you go. Okay. Thank you, Robert. So nice to be with you. I'll take you out. So my story is, when you give space, literally give it, even if you think it will work, but if you physically give it, it'll give room, and you think, I'm giving you space. And when you honor intelligence, innate intelligence, it will start to circulate and move. And usually it isn't that I'm trying to heal his pain. I'm just trying to let his system start to breathe by itself. And those are the kind of things that I'm teaching in the class. I'm trying to teach you, and there are ways to actually organize your own energy as a practitioner. And there are ways about how you listen and speak with a person, and then how you give them the space, and then what you do with that. That is the technology of clinical energetics. Yeah, very cool. And if you have another one, I'll do another one. If you have another client there, and we could see it again. But it's kind of like 10 minutes.
Yeah,
left.
and you know what? It looks like I didn't get an email from that person, so I can't really send them the Zoom link.
Okay. Are there any other questions?
If you have questions, go ahead and put them in the Zoom chat.
Yeah, if you have any questions, put them in the chat. That's an example of clinical energetics. Giving space, being present in your awareness, contemplative, with whatever is going on for you, for them, and then honoring innate intelligence. And applying that to a clinical interaction or a social interaction or a life situation would fall into this realm of what I'm teaching you about and what I will teach you about. Clinical energetics. What are the biggest challenges that come up? The biggest challenges that come up for practicing this are that we have a programmed way of relating in life that we're used to. We have in our world, we did not grow up with the greatest sense of boundaries and healthy relations as a focus. So we have behaviors that are like, when someone says, I have pain, a lot of times we want to go fix it. I'm not saying that's wrong, but it oftentimes gets in the way of the organic healing process. And that's true when you have something that's been going on for a long time and people have been helping you and it's not getting better. Chances are they're not relating in the best way. Chances are. Not always true, because sometimes things, they're going to be chronic in your life. But usually they should get better about the way someone's relating to you. So the hard thing is that you have a training of not, someone says, I have a pain. There are different ways to relate to that. You don't usually go, oh, pain. You usually say, you have a pain, let me tell you about my pain. Or you have a pain, let me tell you how to fix it. We don't want to do any of that. That's the hard thing, getting out of that way of relating, I think. Otherwise, it's utterly simple. Is there a way to adjust this? And yes, I don't actually, there's a way to project and think of yourself elsewhere. If you think of yourself beyond yourself, some of your energy will go back there, because energy follows thought. So you could be in a small room and you could adjust the energy parameters or the feng shui. And feng shui and energy parameters, that's part of this idea, how you manage the space and the relationship and the, how you have space, how you come forward, go back, how you think about it. All of those are part of the parameters to adjust how this works. So really, clinical energetics is a way to optimize the moment, whatever it is that you're engaged with. But certainly for the clinical encounter, whether it's a needle or an herb, whether you're talking with someone, or whether you're a body worker, or any of the above, or any variation of that, whatever it is that you're trying to accomplish, there's a way to engage this that you can optimize the potential around whatever it is. And I've tried it in every situation in life, and it works really well. Do I want to tell people how to find more from you besides your class in New York? Tell your patient you're giving them space, or you just do it without telling them? I usually tell them, because I think the nervous system likes to know what you're doing. I usually tell people almost everything that I do, but I also want to be sensitive about talking too much, because energy actually likes silence as well. It likes emptiness. And if you talk too much, it might take away. But for some people, that's really good. And then, so I do tell them, I'm going to give you a little room, or I'm just going to step back. I'm going to tune in, be with your energy field. And then for me, so I've been working in New York for 40 plus years, California. I told you all these places. I have my own school. It's called Life Energy Institute. And my name is Gary Strauss. You can find me, if you type in Gary Strauss, you'll find me. Gary Strauss, you'll find me. And my school is, let's see if I can put this, let's see how technologically compliant I am. See if I can get you, yeah, I can. My school, if you wanted to check out our website, we have a lot of classes and offerings in energy work all the time. I've been training people for 35 plus years. Whoops, I should do this to everyone. So let me just put this in, Gary Strauss. And then let me put in my info. And then I'll give you our office number, just in case you want to. But I will be in New York, 7873, I did that right. I will be in New York, and we will have a class on the 14th, I believe, Saturday at Pacific College on clinical energetics. And that's a great place to get a hold of this if that is right for you. Okay. How we doing? Anything else there that you need? Question or? Okay, so it's been a pleasure to be here today with you and Pacific College. I love Pacific College. I think it has been, there are many places in our culture that add value to life and hold the sanctity of it. And Pacific College has been one of those places for me in my life. And I've enjoyed being a part of it and teaching within it. And let me take myself out of the spotlight so that Cynthia comes back. And Cynthia has been a dear friend, and I love her, and she's back.
So I say thank you so much, Gary. I'm speechless. And if you take a class with Gary, I'm not allowed to guarantee you that we'll refund you if you don't like the class.
I will.
We're not allowed to, but I
okay.
would if I was allowed to. We get some of the most positive comments from Gary's classes from people who say, this really affected my work more than most anything. And a fabulous side effect is you come out of the classes feeling great yourself too, and getting some healing. The link to the class is in the chat. Gary gave you information about how to find him in general. Thank you, Gary. Thank you to Rob Nadeau. Thank you to Jose Castillo. Thank you to you all. We hope you have a great rest of your evening, and we will see you next time.
Thanks, Sam.